So I'm going to go ahead and start our roll call vote now. Dan McIntyre.
Here.
Lisa Judd.
Here.
Diana Clark, or anyone from the Ukiah Senior Center. Okay. Judy Albert.
Here.
Grace Peeler, Stinkwood.
Here. I'm here.
Xenia.
Here.
Okay. And we'll get to it in a minute. Wynn.
Here.
Karen Lovato already said she's here. Amanda Archer.
Here.
Jacqueline Williams.
Here.
Carla Harris.
Here.
Sean Kaiser, or anyone from the city of Ukiah, excuse me.
This is Shannon Riley. I'm here, and Sean will be joining us as soon as he's able to.
Okay, I'm going to say that your agency is present. Sandra Stolfi? Sandra, anyone from the clinic? I don't see her on the list. I'm going to keep going. QB Anthony? Are you here, Q? Don't see him on the list. Rosanna Ibarra? I was told that Lindsay Spencer was unable to attend today, but she may send Rosanna instead. We'll see if she joins. Sage Wolf? I see you, Sage. There we go.
Here. Hi. Here.
Hi. And Blythe Post.
Here.
Hi, Blythe. Okay.
Hi.
I wanted to share with the board before I state if there's a quorum or not that we've actually had 3 board terms expire at the beginning of March, and those belong to Redwood Communities. Well, it's the Shelter Representative North Inland, currently occupied by Redwood Community Services. Sage Wolf is here representing them. Organizations serving the needs of families with children, currently occupied by Mendocino County Office of Education, represented by Blythe Post, and organization providing healthcare services to the homeless, currently occupied by Mendocino Community Health Clinics. Because those 3 terms have expired, we're unfortunately unable to have them be part of the quorum or the voting for today. So we have a total of 14 seats occupied. And so we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. We have 9 out of that 14 present. Quorum is present.
Thank you. And those board seats will be dealt with later in the meeting, so just FYI. Is there any public comment on any non-agendized items?
You're offline, so I can't IM you. And no YouTube yet.
I started it.
Okay, so not hearing any public comment, we need approval for the minutes for April 2nd, 2020.
Any public comment on non-aborted John?
Veronica, we can hear you whispering, which is
Sorry.
fine. That's okay if you.
I move to approve the minutes.
Is there a second for that motion?
I second that motion.
Is there any corrections for the minutes? Can you have do a roll call, Veronica?
Yes.
Before you do that, can I ask a question? Is the YouTube thing up yet?
Yes.
I got a question about, it doesn't look like anything's happening.
Sorry. On my public page, it's active. It may be a different link. It may not have gone live on there. It may have done a different one. Dan, I don't know what's going on with the technology. It's on YouTube. I'm seeing it. There's a delay there's quite a big delay between our meeting and what the public is seeing. I'm not really sure why no one's able to see what's on YouTube.
It could be an error on my end. I can see it when I go on my phone and look at the YouTube channel. I mean, it's quite a delay. So I apologize for interrupting the meeting for that, but I just wanted to double check because it looked like it wasn't happening. But I think that people might not have the right link. But it is up on the link you sent us just a bit ago, Veronica.
They were the same link, I believe. So I don't understand why it would be different.
I'm not sure either. My apologies. Proceed.
Okay.
I will
because
investigate.
there was a delay, there was some public comment. Hold on just a second.
We'll go back to public comment in one
Public
second.
comment on the board minutes. Did we have a date correction from someone? Is that what I heard?
Yes, it was April minutes, or actually the 20th.
So apparently the correction from the public is that the minutes are labeled as so that is not a correction. I'm sorry. This is the April 2nd minutes, and that's what's listed on the agenda and aligns with the minutes attached. We don't have April 20th minutes available at this time. They will be provided at the next meeting. Okay, so let's go back. Let's go back to the approval for the minutes. By roll call, please say yes, no, or abstain. Dan McIntyre.
Yes.
Lisa Judd.
Yes.
Diana Clark is not present. I'm sorry. Judy Albert.
Yes.
Grace Peeler-Sinkowitz.
Yes.
Susan Wynn Novotny.
Yes.
Karen Lovato.
Yes.
Amanda Archer.
Yes.
Jacqueline Williams.
Yes.
Carla Harris.
Yes.
City of Ukiah.
This is Shannon. I'm not actually a board member. I don't know if I can approve that for Sean or not. He's not here yet.
You're listed as an alternate, so you're welcome to be in place of Sean at any time.
Then yes.
So, Veronica, I actually think that's not quite correct. It's an organization representing law enforcement, and I'm not sure that Shannon is listed.
Oh,
That's correct.
It's not
okay,
city.
maybe you're right. Maybe it's
I
not City of
didn't think I
Ukiah.
was a voting member.
So Shannon does not get to vote.
It's either Sean
Okay,
or
never mind.
law enforcement. That's in law enforcement.
Okay. 2, 3, 4, 5, 6, 7, 8, 9. We have 9 yeas, 0 no's, and 0 abstentions. Motion passed.
Thank you. So we're going to move on to updates from local jurisdictions. Since there's a delay in the broadcast, we're going to take public comment at the end of this update. So we'll take public comment at the end of number 1. County of Mendocino, Tammy or Megan?
Tammy is not present, and I don't have any update from the County of Mendocino, unless anyone has a specific question.
Hey, beautiful, you've got a sex message.
Any questions from the board? Hearing no questions, I'm going to go to Shannon with the City of Ukiah.
Good afternoon. Just a couple of things. We have been collaborating with the county on a plan to address the encampment near the airport. I think some of the service providers will be hearing more about that as we move on, but the encampment continues to grow in size and is somewhat destabilizing. There was a dumpster fire over the weekend and stuff. So anyway, there's a plan being developed to address that. We really appreciate the county's efforts here and are looking forward to that project together. And then I'll just kind of say that there's this, we don't know exactly when it will happen, but there's this time out there in the not too distant future where the winter shelter, the night shelter will cease operations for the year or for this season. The encampment will likely be cleared out, and then the motel vouchers are probably going to run out at some point too. And so there's a chance that all of those things could be happening around the same time. And so I think we want to convey that that's out there and we should all be paying attention and preparing for it. So I think that's all I have.
Okay, thank you, Shannon. Is there any questions for Shannon from the board? No, okay. Tabitha or Sarah with the City of Fort Bragg.
Hello, this is Sarah McCormick.
Hello, Sarah.
Hello. City of Fort Bragg does not really have an update. We do have plans that once the voucher program ceases operation, we're going to do some additional surveillance testing. But yeah, that's all I pretty much have for right now.
Okay, thank you, Sarah. Is there any questions for Sarah from the board? Okay, is there any public comment on any of the jurisdiction reports? I'll wait for you, Veronica, to tell me if there's any or not, because I can't have it from my end.
As far as I am aware, there are no other jurisdictions present.
Okay, or is there any public comment on the jurisdictions?
Let me ask. We have one member of the public present, and YouTube hasn't caught up to where we're at right now. So if he has any public comment, I'll let you guys know and we can come back to that. Is that okay? So we can move forward?
Yeah, fine.
Okay, our public member said that's okay. So Dan, if that's okay with you, we can move forward.
That's fine with me. Okay, we're going to move on to standing committee reports. For the strategic planning, I'll just briefly say that Shannon and I are working on a letter to the jurisdictions to present the approved strategic plan for their endorsement. And that's pretty much where we're at. We hope to have that in process and out in the next couple of weeks. Is there any questions from the board?
I have a question. If you received my email that I sent to Veronica and Megan regarding Manzanita being listed in the strategic planning document, since we do HMIS coordinated entry, we're not one of the resources listed. We're only listed in the line item for contracts. And so I put in a request, and I'm sorry I'm late noticing it and acting on it, to have Manzanita also listed as a resource in Willits and Ukiah, because we're open during the voucher windows. we see people for PSH, et cetera.
Okay, thank you, Wendy. Angelica, or is there anybody on Shelter and Solutions that want to give a report?
As far as I'm aware, Angelica's not present. More people have just come into the waiting room and are joining us. There is one person with a ends in 425 phone number. I'm admitting.
I know Sean's trying to get in.
Okay. I'm admitting Q and Sean. But as far as I know, Angelica is not present.
Okay, is there anybody else that is on the committee that wants to give a report, or we can skip it?
I missed the last meeting, so I can't give an update.
Okay, we'll just skip it for now. So the next one would be quarter entry discharge planning. Is there any brief update you want to give, Sage?
I'll just be brief because we do have an action item with the bulk of our staff for coordinated entry. We've been meeting more regularly than usual, so we've increased the frequency for now of our committee meetings in order to respond to the changing needs for coordinated entry. So we're meeting weekly, and we'll need to post those meetings, and they're on Thursdays from 10 to 11:30 roughly via Zoom, and we've got the HUD TA on board, has been coming to a couple of those meetings now, and that has been incredibly helpful to share with us how other communities are adjusting their coordinated entry systems to prioritize folks differently. That's been our big focus, is how we're utilizing coordinated entry right now to prioritize people who are most vulnerable to risks and complications associated with COVID-19. So we'll be presenting that a little bit later in the meeting. And then the communities housing navigation group, which it's not a committee or a work group, it's just a standing meeting that has happened twice a month historically for direct service providers to talk about what they're doing and what support do they need to best help specific clients and some of our more direct service focused issues. So that group is also meeting weekly right now on Fridays, and specifically to focus around those people who are experiencing homelessness, who are most at risk for complications due to COVID-19. So that's my update.
Okay, thank you, Sage. Is there any questions for Sage? I see no questions. Veronica, do you have a membership committee report? I don't think we had a meeting lately.
We did not have a meeting since our last board report, so I have nothing new to report for the membership committee.
All right, thank you, Veronica. Is Gary on, or anybody have anything on HMIS or performance measurement?
Gary's helping me with the public comment line, so I'll go ahead and give the report. We haven't been able to meet the last couple of meetings, last couple months, because COVID-19 hit, and we've been focused on getting our coordinated entry system to work right, getting people in motels, things like that. So unfortunately, our focus on that has been in conjunction with other projects, and we haven't really focused on HMIS committee work. But I'm happy to report that all clients are fully transferred from the old system to the new, that our new system is up and running the way that it's supposed to, and we've created a new project for our motel voucher for the pandemic project through Project Room Key. Those folks are actively being entered into the HMIS system. The HMIS lead, so my team, is able to provide reports of data quality to each individual agency so that they can look at the data they've entered, make improvements, things like that. So we're still doing the work in the background. It's just kind of piecemealed with everything else that we're doing in hand with the pandemic response.
Okay, thank you. Is there any questions for Veronica on that? Okay, is there any public comment on any of the standing committee reports?
I can hear it on the public comment line. If you give it just a minute, they'll catch up and I'll ask them.
Any questions for Veronica on that?
We're now accepting public comment. Is anyone on the line wanting to give public comment on anything so far in the meeting, whether it was the public comment on non-board? I can hear myself. Sorry, guys. Steve, did you have any comment?
No.
Okay, no public comment at this time. Thank you.
All right, thank you.
We're now accepting
Okay, we're going to skip to the ad hoc committee reports. Is there anything to report, Veronica, on the point in time count?
No, not at this time. Actually, HUD has moved our date to June 30th, so we have until the end of next month to get everything into HUD because of the pandemic.
Okay, thank you. Is there any questions from the board on the ad hoc committee for a point in time? Okay, not being heard. I do not have a report for the HAP ad hoc, except that we will be meeting sometime this month to discuss the HAP funding and what our recommendations are going to be to the board in June's meeting for some of the money that is going to be supported out of the HAP funds. Any questions from the board on the HAP funds? Veronica, do you have an ESG meeting report?
Yes, the committee met and later in the meeting, I'll be telling you more about what occurred because I'll be presenting to you the revised agenda, timeline for the NOFA and our local RFP. It's released, it's available on both the HHSA's Hand Up Not Handout website hosted for the COC and as well as the HHSA Adult Services Continuum of Care webpage. So it's available to the public, it's available to everyone here. I'm the primary contact person, so if anybody has any questions about how to apply, how to access information, things like that, please let me know. The local I'll share when the local deadline is later in the meeting.
Okay. Is there any public comment on any of the committee reports?
One moment, please. Gary, has anyone besides Steve joined us?
No.
Steve, do you have any public comment? One more time, Steve. Okay, thank you. No public comment.
Okay, thank you. We're going to move on to section E in the board meeting with under board protocols and governance. Megan, do you want to take item number 1, please?
Yes, this is item E1, and I am noticing the board that the Mendocino County COC lead agency has been selected for an audit. So I'm just going to read the statement because I'm not actually allowed to say much more than that. So the California State Auditor is responsible for conducting audits requested by the legislature. and approved by the Joint Legislative Audit Committee. This committee has approved an audit request regarding continuum of care agencies to assess best practices related to homeless services. And they are therefore going to be conducting an audit of the county and its relationship to the Mendocino County continuum of care. I've not been through an audit process before, and so it's been a learning experience for Veronica and I, and we have been advised that we cannot comment on this. It's all supposed to be confidential until the final audit report is done.
Thank you, Megan.
Megan, I just wanted to add on that they did share at our last check-in that we will have an opportunity to bring the draft report to the COC board, but it has to be in closed session so that the COC board can make a comment before the final draft is submitted back to the auditor for public publishment.
Okay.
Yeah.
I do know that they're on a really tight timeline, and we're hoping to have the audit done by June 30th. So that's really soon.
Okay, thank you. Is there any board questions on this, even though they can't answer them?
I mean, I don't know if I can answer.
I was just curious, sometimes when we think of audits, we think of financial audits, but is this more in terms of policies, procedures? Is everything lined up at the COC according to what the state requires?
So far, it appears to be mostly policies and procedures and program elements.
Okay, all right.
But we're in the very beginning. That's what it appears to be so far.
Okay, thank you.
So this Jackie with the question. I'm trying to imagine how they do this. So this is just a paper sending they make a request and you're sending them our documents or
yes. The requesting documents that we are responding with, I think there's gonna be a lot of lengthy phone conversations between the auditors and mostly Veronica, but I'm on those calls as well. And they did say they're gonna come here for a week and do whatever auditors do. So we'll see how it all unfolds.
Wow.
Okay.
I was informed at the beginning of the process, this is usually all done in person on site, but because of COVID-19, they're doing everything through email, but they may have up to a week site visit at the end of it before they close it up.
And I will state, because I think this was said publicly, there was either 5 or 6 counties that were selected across the state.
Lucky us.
I think that's kind of the case, yeah.
My sympathies.
Yeah, it's not that fun.
Thank you. Okay, so who wants to cover the action item on coordinated entry? Sage?
I think me.
Okay, I think that sounds like a good idea because I don't know about it.
Okay, sorry. So the Coordinated Entry Committee has put in a request. We put together a proposal. You will find it on page, hold on, sorry. Oh my gosh, where is it?
My sincerest apologies. I did not get the pack name. Yeah, so it starts following the minutes.
Okay, so following the minutes, it's 1 page, COVID-19 coordinated entry emergency protocols. So this is a policy or an addendum to our coordinated entry policy and procedures that the Coordinated Entry Committee meets or put together. I'm not going to go through the word. I'm hoping you guys had an opportunity to look at it, but I will give you the gist of it. And if you have any additional questions, then we're happy to respond to those. So what we have come to in the Coordinated Entry Committee is the desire to both to really kind of to prioritize those people who are most at risk for complications due to COVID-19 and really focus in on those folks. We have an opportunity here with those people who are in Project Room Key, the hotel voucher program, to do some really targeted efforts with those people and to make a difference here that can really impact health and safety. this is something that's being done at various COCs around the nation, and so we did get assistance through our HUD TA on how to best put this together. So the goal of the policy is to be able to reprioritize for a temporary period of time our coordinated entry screening process. The other piece that's in this policy is asking the board to authorize a temporary policy for the coordinated entry committee to be able to make and implement adjustments and decisions related to the coordinated entry process. So we're asking this policy to be in effect for at least 60 days after the social distancing element of the Mendocino County Public Health Order is lifted, or until further action is taken by the Coordinated Entry Committee and or this board. And to give you a little bit more information about the exact policy that we're proposing, the Coordinated Entry Committee would like the board to authorize the committee to be able to make decisions without having to bring those decisions back to the board during this time. In order for us to be able to respond quickly and adjust the policies, bringing them back to a monthly board meeting for approval would be really cumbersome, and so we're asking for the board to be able to give some authority to the committee. And then for the prioritization process, what we have done, rather than making coordinated entry accessible to every single person in the community experiencing homelessness, we've really tightened it down to being accessible and to those people experiencing literal homelessness and have at least one, they meet at least one of the criteria for high risk for COVID-19. And we are utilizing the CDC criteria for the high risk for complications. And then those people that meet those criteria would then be prioritized, with the highest priority being those who meet chronic homelessness criteria and have 3 or more COVID-19 risk factors. And then second priority being meet the chronic homelessness criteria and have 1 to 2 COVID-19 risk factors. Third priority being meet literally homeless criteria and have 3 or more COVID-19 risk factors. And fourth being they meet literally homeless and 1 to 2 COVID-19 risk factors. That is our proposal.
Okay, is there any questions from the board?
So Sage, I know that the age is certainly one of the COVID-19 factors, but some of the others have to do with a person's physical health and chronic disease status. Does that get into problems with HIPAA or anything like that?
Get into problem. Can you say a little bit more, like what problems would it raise with HIPAA?
No, I'm just wondering, because the person, you're depending on the person themselves to self-disclose, then what other?
So at the beginning, we're asking a series of questions and asking them to self-disclose. Once they got pulled for, say they got selected for permanent supportive housing or they got selected for rapid rehousing, at that time, those providers could ask for verification with a doctor's signature, just like our permanent supportive housing already asks for that information, verification of disability. So this would be a verification of meeting COVID-19 risk factors. And on our screening tool itself, that is disclosed. So part of our screening tool is to tell the participant or the person that we're screening that once they were selected for a resource, they could be, these risk factors could be asked to be verified by a doctor or a licensed professional.
Okay, thank you.
Mm-hmm.
Is there any other questions from the board?
Yeah, this is Karen Lovato, just to follow up on that. Will there be flexibility for input from service providers when the individual may not have a good sense of awareness of what their COVID risk factors are, or a good, reliable reporting on what their risk factors are?
Yeah, 100%. That's already, I think, in place in our coordinated entry system, that providers who have a client that they're working with, and that they would either could screen them themselves if they're trained in one of the coordinated entry screeners, or could certainly work with the client on their screening.
Thank you. Yes, I know we do it with the standard. I just wanted to make sure that was still going to be the case with risk factors. Thank you very much.
Any other comments or questions?
Yeah, this is Sandra from the VA.
I do want to add one thing about impacts our coordinated entry system. So it would impact our coordinated entry system in that the housing resources that are available through coordinated entry, those being permanent supportive housing, rapid rehousing, and permanent supportive housing, including programs that have agreed to utilize coordinated entry, those programs would be expected to utilize these prioritizations when they are filling or accepting referrals for their openings.
Sandra, you had a question?
Okay, so yeah, I want to give a comment because this new policy regarding coordinated entry is recommended action related to the second or third point about the changes for permanent supporting housing. I am representing the VA and I want to express my concern regarding this policy because according to the CDC permanent housing projects, veterans have preference. But with that said, with this new policy, veterans are not going to have a preference. At this moment, we have veterans that are using the motel vouchers. They are chronic homeless and they have serious medical condition. But what is the agreement was that veterans were not going to have this preference for the project or the permanent housing that is through the CDC. I also want to express my concern because I have said that the VA, we have the hot bus voucher section A is not working at this moment because VA reasons. So we don't have our veterans, housing plan available at this moment. And so we are asking for this veterans preference. So we are really worried that this is not going to be considered because as Sage mentioned, there are many waiting lists that are around the country and United States that veterans keep the preference during COVID time. So pre-COVID, we have the preference, but now during COVID is that seems like this preference is not going to continue.
I really want to be clear on what coordinated entry has influence over and what we don't at this time. So the coordinated entry committee has influence over the coordinated entry policy. That's what, not influence meaning decision-making power, and can make recommendations to the COC board. What we can ask for different providers to do things, but we can't demand. We can't. So CDC is still going to have their preference in place for veterans for permanent housing, to my knowledge. That's, if they change their preference for veterans, that's up to the CDC. The coordinated entry policies has not had any policy in the coordinated entry policy itself to prioritize veterans over others. That's been a CDC for their permanent supportive housing policy. We're not asking for that policy to be changed. So Sandra, I believe that what you're concerned about I understand the concern, but it's not up to the coordinated entry committee on whether or not that policy is considered. The individual provider is still going to have their own preferences and eligibility criteria and things that they look at. So I hope that reassures you that the veterans you're concerned about are still going to receive a preference if that is in line with the CDC's policy.
And just to add to that, one of our, as a public housing agency, one of our state regulations is to give veterans a preference. So we will continue to do so. And I think in our next thing with the verbiage on our particular as grant administrators for the permanent supportive housing, we will keep that in place. That will not change.
Okay, perfect. Thank you.
Is there any other comments or questions? If not, we're going to need a motion for this.
So Dan's waiting for a motion from somebody. The recommended motion would be to approve the temporary changes to the coordinated entry prioritization to reflect current community needs during COVID-19.
I make a motion.
Yep.
So it sounded like Susan made the motion and I missed who seconded it. Did somebody second it?
Jackie did.
Okay. Veronica, do you have that?
Do you want it? It will be recorded in this. So whenever I minutes, I'm going to go back to it.
Okay.
So as far as the exact language goes, I think we'll be okay. As long as the board is very clear on what they are approving, which is approving this document presented before them.
Is there any public comment on this before we call for a roll call?
We need to give them a moment to catch up. Recorded in this, so whenever I minutes, I'm going to go back to it. Okay. So as far as the exact language goes, I think we'll be okay. As long as the board is very clear on what they are approving, which is approving this document presented before them. Yes, Steve. We need to give them a moment to catch up. Gary, please mute your phone.
Question?
Gary, mute.
Veronica, did you get online?
Okay, I don't know. Gary, I need you to mute your phone, please, so we can hear Steve. Okay, go ahead, Steve. Steve, you're breaking up. Are you speaking?
No, I was not speaking there.
Okay, go ahead. What's your public comment?
The delay is well, I have a question about the next page or two. So I'll be only talking about that. I'll be only addressing that one page that Sage was showing us.
Yes, the next pages will be in the pages. Yes, the following pages are for another motion. It's only this one page we're discussing, the COVID-19 coordinated entry emergency protocols, one page only.
Okay, Veronica?
Yes.
Just give me the bottom line there, because the 20-second delay is, I got one in each ear and it's confusing me here. So.
Do you have do you have public comment on this one page?
No, for the next page as well.
Okay, okay. We'll call on you then. Thank you. No public comment at this time.
Okay, can we have a roll call?
Okay, please say yes, no, or abstain when you hear your name. Dan?
Yes.
Lisa?
Yes.
Judy?
Yes.
Grace?
Yes.
Wind?
Yes.
Karen?
Yes.
Amanda?
Yes.
Jackie?
Yes.
Carla,
Yes.
Sean, are you here, Sean?
He just
Sean
said it.
texted yes.
I don't.
Sean texted in the chat yes.
Thank you. Sandra?
Yes.
Q? Q? I unmuted you.
Oh, you had me on mute?
You muted, yes. When you enter, you're automatically muted. Yes or no, or abstain?
Yes. I was trying to make ask a question earlier, but that passed because I was on mute.
Oh, did you have, okay. So that's, the motion passes. Did you want to make your comment? I don't know how you want to handle that, Dan.
Sorry about that. Did Q have a comment?
I had a question, but I wasn't quite sure if it was on the right topic. I was more of like trying to figure out if, especially with the COVID-19 and coordinated entry and everything like that, I'm foreseeing the long-term fallout of, like, say, people who, because of not being able to find work and or losing their jobs, the fallout of that, and how the increase, especially with rent being due and everything, and the trickle-down effect of the influx of unhoused individuals that we will receive after everything is lifted, after everything is quote unquote going back to normal, what will happen after that in, like, say, coordinated entry and or everything else, and if that was covered in this new plan.
Now, that was not covered in this new plan. This new plan was really covering the risk associated with COVID-19. Jackie and I, along with the ad hoc committee for homelessness from the supervisor, did discuss the importance of this issue moving forward. And it's going to be an issue that we will have to address as a COC, and we're going to address some of it in the HAP funding ad hoc committee and bring back some recommendations of how we can redirect possibly some of the funding we had for other things to possibly help those recover from their behind rent if there's no other federal program that's going to step in between now and then.
Understandable. I'm just foreseeing that that happening and being able to have that covered, because unfortunately that is going to end up happening in the long run if you don't address it, or at least start taking the measures to address it. We're going to be standing there with our pants around our ankles, so to speak.
Yeah, no,
So
it's going to be an issue.
that's all I had to ask.
Lisa, do you want to do item number 3 on the agenda?
So basically, item number 3 is just exactly what to go along with what the coordinated entry committee just wanted changes. So it's really the same as it has been in the past, but on item D, where it says referral, we added verbiage there, and I'd actually like to slightly modify one thing on that, and that basically is saying CDC participates in the coordinated entry process. Referrals will be pulled by the by name list as funding is available, but here's where it's different. It says, note, because CDC participates in the COC coordinated entry process, CDC has designed this section to mirror that process. Should that process change and be approved by the COC board, CDC will follow the currently adopted COC coordinated entry process. And then this is the part I wanted to slightly change, as approved by the CDC board, or in times of emergency, the executive director. So basically what this allows us to do is when the coordinated entry committee changes their priorities, we can also mirror that process. But then there's also a disclaimer, right, that says, right past that, nothing in this would allow for changes to be made or implemented that is not in compliance with federal, state, or local laws or grant conditions outlined by our funding source, the U.S. Department of Housing and Urban Development. So in other words, if the coordinated entry changes any of their policies and we're no longer in compliance, then we would obviously we would not be able to do that portion. So like for the veterans, and this would be a perfect example, the state regulation says that for us as a housing authority, we have to give veterans a preference. So we'll continue to do so. So it's really just that one paragraph, D, and then that one minor change that should say by the CDC, approved by the CDC board, or in times of emergency, the executive director. So that's the change that we need to have approved.
Okay, is there any questions from the board?
I just shared the page that Lisa was referring to making changes in, if anyone wanted to see that.
Thank you, Veronica. And again, there is that just one minor change, and that should be that as approved by the CDC board, except in times of emergency, the executive director. Because our normal process is that it would be approved by the COC board and the CDC board.
So I'm editing this. Where exactly would it be? Because CDC part in the highlighted part?
It's right after, let's see, it says, currently adopted COC coordinated entry process, comma, as approved by the CDC board. So it should say, instead of the executive, it should say by the CDC board, or in times of emergency, the executive director.
I don't think I could write all of that in this particular one, but I think people can see.
Basically, we've had challenges as well with having our CDC board. So in times of emergency, if the coordinated entry process changes, as much as we are able to, we'd like to be able to mirror that process. Sorry, I know we did this Friday. I mean, this just came down the pipeline from our coordinated entry discharge planning committee late last week. And so we didn't have much time to update this.
It happens.
Is there any
So
other,
should we, oh, go ahead, Dan.
is there any other questions?
I know we have public comment on this item.
I'll get the public comment after we have a motion on the floor. Is there a motion for this ordinance, please? For this change?
I give that motion to change to the needed amendment.
Second for the motion?
A second.
Okay, public comment, Veronica?
The COC board is now accepting public comment on agenda item number E3 regarding the permanent supportive housing policies. Does anyone have public comment?
Yeah.
Go ahead. Steve, go ahead. We're listening.
Well, two questions about this, but first, let me mention something on process. My understanding is that public comment ought to be taken before a motion, because in theory, public comment may affect the motion. So that's certainly the way you do it in the city council. But anyway, okay, two questions. This is going to page 12 of the packet, which is the first page of this section, also the page immediately following what Sage showed us a few minutes ago. On the criteria mentioned, there's A, B, and C. A is serious mental illness. B is chronic alcohol and or drug abuse. So on the serious mental illness, the question is a woman, there's one particular woman at the homeless encampment who apparently is keeping people awake a lot of the night because she's arguing with herself quite loudly. And that sounds like a possible mental illness. So who has the ball to look into situations like that? And who do I tell, and what's the action that takes place? And the second question is the next paragraph on the page, persons with physical disabilities, doo-dah. A week and a half ago at the encampment was a woman, a late middle-aged woman in a wheelchair. Who is the person in the COC that has the ball for a situation like that? And if I see that kind of situation, who should I inform?
All right, thank you, Steve. We'll get you those answers offline outside of this meeting or towards the end of who your best contact would be for the serious mental illness or the physical disabilities on that. Any other additional discussion from the board? Roll call, Veronica.
Please say yes, no, or abstain when I call your name. Dan.
Yes.
Lisa.
Yes.
Judy.
Yes.
Grace.
Yes.
Wind.
Yes.
Aaron.
Yes.
Amanda.
Yes. And just
Jackie.
quickly, Veronica, I'm
Yes.
just wondering if people on YouTube are seeing the internal chat for this. There's a lot of chatting going on. Might be just
I really don't know. That would be the settings within YouTube, how YouTube and Zoom work. I have no clue.
So I would caution people that I do believe that the group chat thing can become public at almost any time. So it might be a good idea to be careful with the chat, even though it's fun. It might be a good idea not to do it.
We actually just can't use the chat because it's a public meeting, so it just needs to.
that's what I was wondering. Thank you.
I will disable it for future meetings. Okay, so that was Amanda. Jackie.
Yes.
Okay. Carla.
Yes.
Sean? Can't use the chat. You got to say yes or no. I'm not hearing anything from Sean, so I'm going to put him under as abstain. Sandra.
Yes.
And Q.
Yes.
Motion passes.
Thank you. Veronica, this next part's yours for the nominations for vacancies.
Okay, I'll handle this part. So we currently have 3 vacancies on our board. There are 3 seats that expired in March 2020. And according to our process, I will entertain nominations for those seats right now, if anybody would like to make a nomination. And I will also point out that we accept nominations until, Veronica, what did we say? Until June 19th. June 19th. And Veronica will also send out an email message to the entire board membership to see if there are any other nominations for these seats. and let them know the deadline is June 19th. But I would entertain any nominations for these seats at this time. So if there's anybody who would like to nominate a homeless or formerly homeless transition age youth, that seat is currently vacant. I do know that we've had trouble filling this seat in the past. So if anybody has a nomination of a homeless or current or formerly homeless transition age youth that they know wants to be on the board, this would be a good time to nominate that person. So I think what I'm going to do, sorry, Q, did you have something? Go ahead, Q.
I said still looking. Okay.
So I'm just going to list out the 4 seats that are available. It's actually 4 seats. And then you can unmute if somebody wants to nominate somebody for those seats. Now would be a good time. So we have the homeless or formerly homeless transition age youth, the seat held by a shelter representative for the north or inland part of Mendocino County, an organization serving the needs of families with children, and an organization providing healthcare services to the homeless. Is there anybody who would like to nominate a COC member for any of these 4 seats at this time?
This is Amanda. I do have a youth in mind, homeless youth, but I would like to be able to speak to them ahead of nominating. Okay. Is that okay by email?
Yes, Amanda, if you want to submit, after you talk to that youth, if you want to submit the nomination to Veronica by email, that would be great. We're voting on nominations at our June meeting. So we can only add new people to the board at the general membership meetings, which are March, June, September, and December. So we're not actually voting on the nominations today. We're just accepting nominations for the seats that will be filled in June.
Fantastic.
So long answer, Amanda, yes, if you have until the 19th.
Great, thank you.
It might be easier to go seat by seat. Okay. So it doesn't, we have any TAY nominations at this time?
Okay, do we have any nominations for the shelter representative for the North Inland part of the county?
You could nominate yourself.
So I might point out that there is only one shelter in the North and Inland part of the county.
That's not already on the board in a different seat.
Correct.
Yeah.
So can't nominate Sage.
Thank you, Q. So Q, you're nominating actually Redwood Community Services for that seat. The way this works is we nominate an organization, and then that organization chooses the representative. Okay.
Yep. Sorry, backtrack, rewind. We already have thoughts, Q. I'm nominating RCS.
Okay, thank you.
So I have a question, and if RCS is holding a seat on the COC, can they hold a second seat?
No.
No.
So Sage is already on the board, Q.
No, I'm sorry, Winter. That term is expired. She's just here as a participant right now. She's not voting or anything. Yeah.
And the same is for Blythe Post and Xenia Levacho. Those 3 board members, their terms have expired, so they're not able to participate in voting. They're just here because we need them.
So, Veronica, I have a question.
Yeah.
So, I mean, is it too presumptive to ask those Blythe and Xenia and Sage if they would like to continue being on the board? Is that too presumptive? Because, I mean,
well, that would be done through them accepting the nomination or nominating themselves.
Well, I would be happy to nominate both of them. I have always felt that people who participate on the COC board, not that we want to have people be there for 30 years, but that it's more helpful if they have some history with it and some background. So I'd be happy to nominate both of them.
I'll be happy to second.
So that's great. So I would say it sounds like, Judy, you're nominating
Xenia.
Yeah, you're nominating MCOE to serve the seat for the organization serving the needs of families with children.
Right.
And you're not nominating MCHC Health Clinic for the organization providing healthcare services to the homeless.
Yes.
Okay.
And I would have done the same for Sage if I'd understood.
Okay, I know this is a little bit rough, but and then if there's rival nominations, we will accept them through June 19th. So, you know, we can continue to do that. But unless we hear differently, we will prepare a ballot for those 3 seats and any others that come forward or any other nominations that come forward by June 19th. And when you vote, the membership will be voting at the June meeting.
So to continue being, following our processes, do these 3 nominations, these 3 organizations being nominated, accept their nominations?
It's a good question.
Yes.
Okay.
I see a thumbs up from RCS. Blythe from MCOE?
Yes.
That's a yes. And Xenia?
Yes.
You guys, thank you.
Okay. And so there are 3-year terms, and hopefully we will not miss them in the future, but I might.
Okay, wait, never mind. I changed my mind. 3 years is too long.
You can quit at any time, but there's nobody else who is going to be, everybody else's term is up to date until next March 2021, in which like half of you are due. So we'll remember next March. And I think that's it for that agenda item, unless there's any other nominations at this time. One other, yeah, that's it for item E4.
Okay, is there any public comment on this?
Is there any public comment on the nominations made during this meeting on agenda item E4?
Not for me. This is Steve.
Any others? Thank you. No public comment at this time.
So through the chair for a moment, since I have the floor, or I kind of had the floor. Dan, this is not exactly related to this item, but it is related to governance. Does anybody have an objection if I check with county council on whether or not we have to do a roll call vote for every single item? I believe that in board situations that I've been in, you usually can just say aye, no, abstentions. And I'm just trying to figure out a way to kind of smooth it, like quicken up our process here. But I don't want to ask the question if you're all really into the roll call vote for every single item.
The process has been pretty functional. I think for now we stick with the roll call vote. You can check with county council, but.
I'm not going to if you want to keep it.
Megan, she's the one that insisted we do it.
I know, it never made sense to me, but I'll leave it for now.
I'm all for asking again. In fact, I'd like us all to just hold up our thumbs and we could just.
Okay, thank you.
Okay, so the next action item is, it's really not, I guess it is an action item. In order to allow the ESG ad hoc committee to complete the rating and ranking for the ESG applications, we want to postpone next month's meeting from what would normally be the 15th to the 29th. Anybody got an objection to that? Because if not, we'd have to have 2 meetings, because we would have to then come back and approve the ESG stuff so we can get it to the state. All right, not hearing any objections or questions on that. Do we actually need a motion on this, Veronica? I don't think we do. I think we
not necessarily. I don't think so. I think if everybody's okay with it, then we just do it. I made it an agenda item just in case.
Yeah, the next meeting's gonna be the 29th instead of the 15th. So,
all right, thank you. Let's give them a moment to catch up. We were kind of running ahead.
Same time, correct?
Yeah, same time.
Same place, same time, same everything, just 2 weeks later. Is there any public comment on the board's decision to postpone the June meeting to June 29th in order to allow the ESG ad hoc committee to complete their steps? Any public comment? Hearing none, I think we can go ahead and move forward, but if anyone has any public comment at any time, please let us know and we will make sure to include you. Go ahead, Dan.
Okay, next one, Veronica, there's no update on cash funds, correct?
Correct.
Do you want to give the board an update on the ESG funds?
Yes, there's two major items I'm bringing forth to the board today. One is to let you know that the ESG ad hoc committee met, reviewed all of the documents, approved them, and they have been placed on both the Hand Up, Not Handout Mendo website and the Mendocino County HHSA website. Those links can be found in the board agenda. We had an extension approved by the state. They actually gave us longer than we asked. They just extended it for their whole entire NOFA got extended to July 29th. So let me scroll down real quick. So applications are due from community organizations on June 1st, 2020 at 7 a.m. That's a Monday. And then that will give the ad hoc committee about 3 weeks to review all the recommendations, all the applications received, and to make recommendations to this board. One moment. So we have a revised timeline. Documents are up. We've talked about postponing the meeting to June 29th. So that's my report on this current RFP for 2020 ESG NOFA.
Any questions for Veronica? What's the resolution you need, Veronica?
So this is a different matter. The federal government passed the CARES Act, and included in that are 2 allocations for the Emergency Solutions Grant. In order to receive the CARES Act ESG funding, the COC board, and I did clarify with our state partners that it truly is the COC board, must pass a resolution that is included with your board packet. The purpose of this is really just so that this board is aware of what's coming in, and that we agree that there's an approved state ESG administrative entity, which is Mendocino County HHSA. And basically, you guys are approving receiving this funds. One thing I want to point out is the resolution is 2 pages long, and is on our COC letterhead. As far as I know, this is our letterhead until we have a few better one. It's the first resolution of this year. I'm not aware of this board doing any resolutions prior to this meeting. And the instructions recommended that the amount listed in this resolution be double the amount of the anticipated allocation, so that if the state decides to give us more money, we don't have to redo this resolution. So I took that recommendation and doubled the amount in the draft HCD consolidated plan that lists how they're going to receive this money and how they're going to get it out to the balance of state. Mendocino County is slated to receive for its first allocation $705,000. So the resolution amount listed is $1,410,000. And I've specifically listed Tammy Moss Chandler as the authorized person to execute the standard agreements as the representative of the administrative entity, so she can do that on behalf of this COC. And that's my presentation. Does anyone have any questions?
Veronica, can you remind the group of when we think these funds are going to show up?
That's a really good question. That could be anywhere from July to October would be my guess. Because they'll need at least 30 days after we sign any standard agreements to get those in place. And they haven't even passed, it's still the consolidated plan is still in draft form. So I really don't think we'll have an answer to that until the state approves their documents.
Okay.
Is there any questions or comments from the board? I'll need a motion to approve the resolution then.
So now would be a good time to unmute your phone because there's going to be a roll call vote in a moment. But Dan's also calling for a motion.
I'll make that motion.
Is there a second?
I second that.
Thank you, Zinnia. Is there any public comment on this?
One moment, let's give it a moment to let people catch up. We have a moment, members of the public, but at this point, the COC board is entertaining public comment on the ESG CARES Act resolution 2020-01. Is there any public comment on this authorizing resolution? I'm seeing no public comment, hearing none. Please, public, if you have anything to share, please speak up at any point. Thank you. No public comment at this time, Dan.
Okay, roll call, please.
Please say yes, no, or abstain to, if you approve the vote, the resolution. Dan?
Yes.
Lisa?
Yes.
Judy? Judy?
Yes.
Thank you. Grace?
Yes, ma'am.
Wind?
Yes.
Karen?
Yes.
Amanda?
Yes.
Jackie?
Yes.
Carla?
Yes.
Sean?
Yep, I'm on phone. So yes to this one and yes to the last one, not abstain.
Yay! Thank you. Sandra?
Yes.
And Q?
Yay.
Motion passed.
Thank you, Veronica. There's no update on the HEAP program. Veronica, do you want to give an update on the HAP money from the Board of Supervisors?
Yeah. So we're working on the standard agreements. I'm working on the internal documents now to get our contracts department to get it to the Board of Supervisors. We're going to have Tammy approve it and then the board ratify it at a later date so that we can get it submitted before the end of this month. The state gave us an extension from May 15th to May 29th to get that documentation submitted. I had originally submitted the COC documentation with Dan's signatures. not quite understanding that that needed to be signed by the administrative entities representative, which is Tammy Moss Chandler, not Dan. So I had to go back and redo those, but where those are in process and will be submitted before the deadline of May 29th.
Any questions? Not hearing any questions. Is there any public comment on the HAP funding update?
To give them a minute. Is there anyone besides Steve and Gary on the public comment line?
I'm here, but I don't think anyone else is.
Okay.
And I'm here too.
Okay, good. Have you guys finished seeing the presentation that I did for HAP?
Yeah, just a minute ago. Yeah.
Yep. Any public comment?
No.
Thank you. No public comments at this time.
Okay. There's no update for FUP or the next update would be for the COVID emergency funds, Veronica?
The standard agreements have been signed and mailed off to the state, so we're looking pretty on that one. And then there's an additional item under agenda item 8B, and when you're ready to introduce that one, Megan's going to take it.
Yeah, if Megan can explain this, because I'm not aware of, I thought we covered the funding for these programs in our meeting on Thursday.
Pardon, Dan?
I thought we covered these fundings under the meeting we had on Thursday with Tammy Moss Chandler and the Board of Supervisors.
That meeting was just with the co-chairs, so I thought it was important to update the full board on the outcome of that. So if you turn to the last page of your packet or the addendum that I emailed out not very long ago, a couple hours ago, this item is related to funding requests that have come before either the county or the COC or both for needs related to homeless services during this time of the COVID-19 response. So the challenge that we had is that there's a number of requests that came in from community-based organizations and other places at the same time that the COC board was making a decision about their COVID homeless emergency funding, and the county, who also got an allocation of COVID-19 homelessness funding, were in different kind of cycles of making their decision making. So the staff report explains the requests that have come in and the resolution of some of them. Not all of them are resolved, but I'm just going to very briefly go through them. Building Bridges through Redwood Community Services submitted a request for $152,741 for expanded shelter staffing during this, mostly for expanded shelter staffing during the pandemic. This covers March through June of 2020. The Health and Human Services Agency is committed to partially funding the request through additional whole person care funding. And the Mendocino County Board of Supervisors will be considering funding the remaining balance through their COVID-19 homeless emergency grant, which is going to be before the board tomorrow. So we're, it appears likely that that funding request will be handled through those two funding sources. I'm just going to go through all of them, and maybe if there's a question, I can take questions at the end. Mendocino Coast Hospitality Center, if some of you may remember, their winter shelter was due to close almost the same day, or like right around the same time that the pandemic began. So they requested funding to extend that through May 10th, which was that's the end of the first shelter in place order or whatever. That funding request, again, covered April 1st through May 10th for the expansion of the winter shelter. HHSA is committed to partially funding the request through whole person care funding of $30,000, and the Board of Supervisors will be considering funding the remaining balance, again, through their county, through their COVID homeless emergency grant at their meeting tomorrow. The City of Fort Bragg, you may remember, submitted a collaborative application of a total of $48,736. that included a variety of items, including support for motel rooms for individuals fleeing domestic violence, extension of the winter shelter rooms, some equipment and supplies, and the safe parking program. With the exception of the safe parking program, we believe that all of those needs were met or became obsolete. And so the remaining unfunded balance is for the safe parking program, but it's not clear it's not clear to me whether or not that's still a priority for that community. And certainly it would be that the COC board has not entertained that program as a discussion item yet either. So I'm just reporting out that that's still there. Moving on, McCavan requested funding for some extra staffing support. They've been really working hard to support our guests living in motels. Health and Human Services has encouraged McCavan to access the funding they've received through their 3-year outreach and engagement contract for pandemic-related outreach service. And so it's possible that that need has also been met, although I haven't had a follow-up from the executive director of McCavan, so I potentially the remaining need for that is 0. And finally, the Health and Human Services Advocacy and Collaboration Team is requesting a flexible immediate housing needs fund. This fund would be used for direct client services related to either helping them transition from the motels to a safe location other than the streets, and or people that are unsheltered on the streets in terms of finding creative and probably not permanent, but some sort of place to be other than the streets. The fund would be available for assisting a homeless individual with a room rental from a friend or family, down payment assistance if the traditional rapid rehousing funds are not an option for them, transportation to a family member living in another community, or whatever barriers they have to achieving stable housing during this time. So the request is for $80,000. The Board of Supervisors is going to consider funding the project up to $37,796 through their homeless emergency grant. Again, that's going to be before the Board of Supervisors tomorrow, but it does leave a remaining balance of need of $42,000. I'm going to pause there and see if there's any questions. This is not necessarily an action item. It's mostly informational, but we wanted to leave room on the agenda. If you did want to take an action of some way, there is room to do that.
So Megan, I'm just sort of surprised because it seems like all the dates are already passed.
Right. You're not wrong. No.
So what does that mean? The money's been spent already by these organizations and they may not get reimbursed? Because these aren't extensions, it's all, is that what that means?
Yes, I mean, I could kind of, there's a little caveats in almost all of them. So for example, RCS had reason to believe that Whole Person Care was going to fund 100,000 of that probably a couple of weeks ago, but they really were, I mean, and Sage can correct me if I'm wrong, kind of just like hoping this was going to work out for them. Mendocino Coast Hospitality Center, those contracts already did go through, but the funding sources had not been identified yet. So there had been a commitment to support that. They just hadn't identified the funding sources. So that's the case for them. Yeah, that it's all sort of happening at the same time that they're actually doing the work.
Okay, so on the coast, the winter shelter is closed now.
That's true. So that they had at the end of the day, at the end of the the cycle, they had I think 16 guests in the winter shelter that had to find other locations after May 10th. I believe, and Carla can fill me in here if she wants to, but my latest update was that some of those people in the winter shelter potentially had room in Hospitality House if they were willing and able to take it. And so I'm not sure they all returned to the streets, but there were 16 people who no longer are in the motel, unless something happened that I have not been updated on.
Mm-hmm.
So they still have 43 individuals in the pandemic prevention motel program who met the high risk criteria in a motel in Fort Bragg. So there's 43 people still there. These were the ones who didn't meet that criteria.
Mm-hmm. Okay.
Are there any other questions? So sounds like no. I will point out that, and In terms of the funding that's available to be redirected to COVID-related needs, we still have at least $42,000 in HEAP interest, and this is interest to the HEAP program that has not been allocated by the board. And Dan, I'll stop there and let you take over.
Okay. So as everybody knows, Jackie and I decided at the direction of the board on the allocation that the COC got. We used that for the pandemic prevention motel program, which we were able to leverage with FEMA dollars, as well as set aside some for domestic violence, which was not funded under any of the programs. So given that, there's still a gap in funding for the basically what I'm calling the exit program from the motels. And it would be my recommendation that the board allocate the HEAP interest to cover that either directly or indirectly by paying other applicable expenses that the HEAP can cover. I know Megan is still working on trying to make sure that the HEAP can actually cover those expenses. Correct, Megan?
Yeah, Dan, and I did look at the language in the HEAP standard agreement and the HEAP expectations, and I believe that we could make a strong case for those costs. Okay. There was enough room in there that I think it would be fine. The one part I'm not totally sure about is transportation, maybe to another home community, but we could use other funds for that. I could pay attention to which ones were HEAP applicable and which ones weren't.
Okay. So it'd be my recommendation from the board, somebody make a motion that we'll use the interest from the HEAP money to help fund the funding gap on the $80,000 exit strategy pool.
So can I ask a question about that 80,000? It sounds like these are for things that for some reason these people might not qualify for rapid rehousing or permanent supportive housing?
Correct. And or there may be, I mean, they may eventually qualify for permanent supportive housing, but in the meantime, if they could find a friend or family who would let them stay with them for a couple months while they wait for that process to happen.
Okay.
Does that make sense?
Yes, and I would caution us to be very careful about that because they would no longer meet the homeless criteria for PSH, which would disqualify them from being considered for that. So you're putting that, if you put them renting a room, even if it's a temporary, they're still renting a room which no longer meets homelessness criteria. So don't bank on them then getting pulled for PSH or rapid rehousing because they would get exited from coordinated entry. And so the other question I have is around like down payment assistance or security deposit assistance from rapid rehousing funds or past due utility payments or things like that. I think that pretty much all of the folks that are in hotels should qualify for either permanent supportive housing or rapid rehousing, especially given our new coordinated entry prioritization. So it could be that we are able to use our rapid rehousing dollars for some of this gap that you're identifying, the 80,000.
I think that's quite possible. This was meant to fill those gaps if rapid rehousing didn't work. And I guess maybe I'm wrong, but being pulled for a permanent supportive housing unit is a far cry from making sure you have a place to live. So, yes. So to me, basically, I think that's an important long-term path to be on, but it hasn't appeared to me as if it's going to meet the needs of the 200 people we have in hotels.
Mm-hmm.
So
Megan, as a comment, I think this is one of the things that is sort of like I think that you're definitely speaking the truth in terms of what are we going to do when suddenly 200 people get released, as of June 1st, what are we going to do? And then the other one is that, like what Sage was saying, that then they might get excluded from the permanent housing. I really think this is something of how do we juggle this, you know, being realistic on both sides. I mean, how do you put these two things together?
I think in my head, I saw this as diversion in some sense, rather than if you can divert, my understanding, and I'm new to this field still, if you can divert somebody from the shelter system, that's what you would want to do. And if you can facilitate their ability to use their natural supports wherever they are, that would be a goal to keep them from the system, quote unquote. So that was what my thought was.
Could any of those funds be used? I'm just thinking, and I'm totally with you, Sage. That's where my brain went, that we might take people out of the running for vouchers if we have them staying with a family member. But even just application fees, because a lot of the folks that we have, if they don't have SSI, they have no income in order to apply for something long term. And I understand the intent, and obviously we don't want to put everybody on the street. And if they have a family member or supportive person in their life to stay with, that's great. But what about folks that, you know, I'm just thinking of the clients I run into that either are applying for SSI or don't have it, but definitely are candidates for it, that have no funds to even apply for long-term housing.
I think this fund could definitely be used for that. To me, that would seem like a barrier to housing that this fund could be used for.
Okay, that's helpful.
Dan, are you calling on people, or do you want me to continue to do that?
I can't see them, so.
Oh, you can't see people?
Well, I can see them, but I can't see them unless they speak.
Okay, Blythe is raising her hand, and then Wind, and then Sage.
Megan, I'm just asking about the particular family that I got housed under the pandemic voucher program, that the father gets the SSI and the son does as well, and he didn't qualify for the CalWORK. So I'm just concerned again with like Sage saying that if we're transitioning and we're asking them to find alternative options at this moment, that it may eventually cut them out of long-term permanent supportive housing. And I am really concerned specifically for that family because they've been living in a car for 3 years. And so what that's going to look like for the families that I have helped get housed during this time.
You know, I have to be honest, I'm really struggling with the idea that we would compel people to live on the streets in order to maybe get a voucher that maybe would work for them that probably won't. So I guess, I mean, that may sound a little more harsh than I mean, but I'm like, this doesn't make a lot of sense to me. So I don't even know how to answer that question, Blythe, I guess. But let Wind had her hand up, and then maybe Sage.
So I think the thing for me too, in our experience, is that if you have 200 people, there are multiple buckets, so to speak, of people falling into categories, people who have no natural supports, or as I can say, unfortunately, especially if you have a severe and persistent mental health, the family may not be capable or able to take you, you know, for a period of time. And I feel like for those who have done this for a long time, I'm thinking a third of them maybe have natural supports, but 2/3 of them, and I feel like I'm being a little conservative, but 2/3 of them are not going to. And so this bucket, we have this bucket of money and need multiple procedures very quickly to determine, you know, where can someone go, and taking the short-term and the long-term effect of this. And in and of itself, this money's an incentive that I wouldn't want to incentivize people to make good short-term, but maybe poor mid and long-term decisions. And so it's very complicated for me, considering
Wind, I do think you're right that I don't think like the uptake of, let's say, the room rentals for a friend or family is going to be very high. I think you're right. I think a lot of people, if they'd had those options, they would have already used them. So I just think that it's a small gap might work for someone, I really don't know how many people would work for.
I think the thing I'd also like to say to all of us, and I know we're all working incredibly hard, is if there's a way that we can coordinate focusing on the very things that must be done in order to secure the Social Security and do the steps. You know, a lot of people fall through the cracks. They don't show up for their appointments to do the paperwork. The paperwork is a mountain, feels like a mountain to climb. I feel like as providers, we need to really note what we're capable of right now to see if we can get these things in place in the next couple weeks to help people forward on their permanent housing path. So, you know, those, and I'm not the one doing the frontline work, you know, in our agency. And so I can check in with Sarah and the care management team and housing team and see how much of that we've done and haven't done in terms of getting that paperwork trail started for those who would qualify for SSI, et cetera. And coordinating with those like McCavan, who's been very much in the encampments. A lot of the people may qualify, but aren't taking the moments with providers to make that happen.
Okay,
So
well,
that's it.
It was just a suggestion. We can decide not to fund it, leave a $42,000 gap. The county, if they pass it tomorrow, will partially fund that $80,000, and we can just leave the heat interest sitting there until we find something else we can use it for.
Dan, this is Jackie with a quick question for Lisa. Lisa, do you anticipate any regulatory changes because of the pandemic, you know, like what we're talking about right now for the, you know, are we going to prioritize keeping people even in temporary situations is better than having them be homeless so they qualify? Do you know of anything?
I've seen a lot fewer regulations for the permanent supportive housing than I have for like our housing choice voucher program. We've only had a couple of big waivers, so I haven't seen any of those changes coming down the pipeline. I mean, of course, I have concerns when I hear about 200 people. We have maybe guessing around 40 certificates out there. So that's still a huge gap there's a lot of people out there, even if we did issued all those certificates and there was housing out there we still have a lot of people, right, that would still need to be housed. And at this point, there might be in the future something where we would look at changing our housing choice voucher program to maybe have a preference regarding people that kind of maybe fit this criteria, but we're not there yet. Sorry, Jackie, I can't hear you.
Jackie, you're muted.
At least not disqualify people that for safety reasons, we've facilitated a safe room.
Right.
That's the goofy part here. You know?
I think it gets complicated because, of course, it's not just some things are our discretion as a housing authority, some things are state,
or federal,
some things are grant requirements, so it gets complicated. So
Megan, I think that Sage had a comment earlier, but we kind of skipped her, Sage.
Sorry,
do you want to say something, Sage?
I don't think it's pertinent. I mean, I guess just to bring it out there that sometimes room rentals can work with things like PSH and rapid rehousing, as long as the place where like if they're renting from a landlord, if they have a friend or family who's renting and they're going to be added to the lease, there is some capacity for at least rapid rehousing, and I'm pretty sure that permanent supportive housing as well, to do room rentals.
If they got an eviction notice from the person they're renting the room from, wouldn't that make them eligible?
They've got an eviction notice. No.
Homeless prevention, but not
prevention.
rapid rehousing.
Oh, not rapid rehousing.
And also consider, so even for chronic homelessness, if they've been homeless for say 2.5 years, they go into housing, renting a room, it then becomes, they had 2.5 years of homelessness. So they met chronic homelessness, but then as soon as they start renting a room and are there for more than 7 days, there's a very short window where they could leave and still, I think, keep their chronic homeless status. They lose their chronic homeless status because they don't meet the 4 times over the last 3 years with a cumulative of 12 months.
And
I really, I hear you, Megan, about not wanting to advocate for anybody staying on the streets when they have an opportunity to rent a room. It's just things to consider.
And that's why the system's broken. So.
Well, I'm sorry. I'm just going to be really blunt. I am going to be really grateful to get that $37,000 from the county board of supervisors, and I am going to facilitate people getting off the street. So I understand it may be in conflict with maybe some long-term plans, but I'm also cognizant, if I'm not wrong, that last year we were able to house 12 people with permanent supportive housing. I mean, we learned that in our strategic plan. So
not even Terrace.
That's not including.
I don't think anybody is speaking against trying to do this, Megan. I think, at least I hope that's not what you're getting from me.
I'm not getting that. I'm not responding in any way to what you guys are saying in terms of the content of what you're saying, but I think I'm personally not willing to perpetuate a broken system, but I don't think we need we don't need the $42,000 in HEAP funding right now for this. I mean, we'll learn how this works in the next couple of weeks. So again, I think Wynn's point is really well taken in the experience that I've had talking to not just a fraction of the people you all talk to, but I don't think very many people have this family and friend support to be able to go to, which is why they haven't done it yet. So the few people that this might work for, I'd like to be able to try it. Again, I do not think that this is going to be a wild uptake, but if it is, that's something we certainly can learn from. So if it turns out that wow, this really works, we should look at that. But we'll learn in the next couple of weeks. Really, no, hopefully a couple months.
So Megan, I support you in this in terms of, I always think that there should be some little pot of money. There are always people who are the exception to the rule. And it always feels terrible when, it's like, this could work for you, but there's nothing there. Right. So, I support it. That's not very much money.
No, and I have no idea how quickly it'll be uptake. And Q, I think you're raising your hand, so I will say that. But I do want to say that the concept of this fund was modeled after City of Boston has something called a barrier busting fund. And the way it was described is it's a pot of money with no rules. And this was brought to our attention through our HUD TA provider. And I love pots of money with no rules. So that really can't, so it's not coming out of nowhere. It does seem to be something other communities have done.
Q, go ahead.
My whole concern, and I do admit that, like everybody's point is valid. My whole concern is going back to what I said earlier. It's the fact that in a couple months' time, when everything blows over, the repercussions that's going to end up happening is also going to end up affecting those situations. Unfortunately, say for instance, Megan, using in some situations, like if we can find somebody who can join their family members, let's do that. And I agree with you there. The only downside with that is that those same families can be in those same dire situations that later on makes them where they're going out into the streets. Hence the reasons why I am overemphasizing us, at least hopefully every different organization starts planning for that downsize effect that's going to happen, because unfortunately COVID-19 happened and it's no going back from what we're already experienced. And in that experiencing that we're going through, there are hundreds of thousands of millions of people who's going to get that effect of the greedy slumlord who's going to want to toss them out on the streets right after everything is said and done. So we need to start preparing ourselves to help our own people in order to prevent that from happening in the masses.
One piece of information I want to share with the board that may impact some of these thoughts and decisions is under the CARES Act ESG funding, HCD is in their consolidated plan is going back to the original federal definition of what activities can be funded. The state of California kind of added their own layer. That's why we have you have to use at least 50% for rapid rehousing and, you know, those kind of requirements. The proposed changes to the consolidated plan for just the CARES Act funding would remove those additional state mandates and open it up for any of those projects. I believe, and I can't be 100% sure of this because we don't have the full approved version yet, that homeless prevention will be a standalone activity that can be funded through ESG. I might be wrong, but I believe that is the case. So I know that a lot of this is, what if we get somebody into a situation and then they struggle when the pandemic is over? But I think that would fall under homeless prevention, and that we would hope to help them either retain that or move on somewhere that's more stable without experiencing homelessness. So even if there was somebody who Megan placed that later struggled, we would hope that, you know, we'll have additional flexible funding down the road to be able to provide that more long-term support. It's just not here yet.
If there's not any other comment on this, we need to move on as we're getting close to the end of our meeting. Is there any additional board comment on this? Is there any public comment on this?
Agenda item 8B, F under funding 8B. Any public comment?
Nope.
No public comment at this time.
Okay, are there any announcements from any agencies?
I'll give one for RCS and the shelter really quick. So we did get approval for the Inland Winter Shelter to stay open through June 30th or the morning of July 1st, I guess. We are still pursuing both the use permission from the city and the funding that would be needed to keep the Inland Winter Shelter open year round. So we do have funding, well, we had funding secured prior to COVID-19, and with COVID-19, we have the additional staffing needs. So, but it looks like that is hopeful to get funded as well through the end of June. But there will be, you know, we have a funding gap to stay open for July, August, September, and October. And so we are putting together a package of narrative and a budget of what exactly that looks like to keep the shelter going year round. And we would like to bring that to the county as well as this board.
So I'd like to say, in light of this conversation and in pure coincidence of timing, that last week Manzanita housed 5 people in permanent housing. So some of that started a year ago. Some of it, I know, so it's heavy lifting, and thank you to everyone who helped and all the collaborations. And of those, 1, 2, 3, 4, I think 4 of the 5 were in hotels through the county voucher and are now in their own homes. So thank you to everyone who helped that happen.
Is there any other announcements?
I just want to say thank you, Wynn, for working so hard on those clients. It's really awesome to see them exiting from the motels to somewhere else.
Okay, if there's no other announcements, the next meeting, as noted earlier, will be June 29th of this month. And Veronica will send out that information. Thank everybody for coming.
Thank you.
Thank you.
Thank you, everyone.
Thank you. Take care. Bye-bye.
Thanks, everybody.
Be
Thank
blessed,
you.
all. Stay safe.
Thank you.